Just a quick review of the book, Running Injuries Handbook, Identification, Treatment, and Prevention to Keep You Running. Basically, the book's divided up into two sections, which totals 8 chapters. The first section is named Common Running Injuries. It's divided up into 6 chapters. The first chapter is Frequent Causes of Injury. Chapter 2 is Achilles tendonitis. 3 is iliotibial band syndrome. 4 is plantar fasciitis. 5 is shin splints, and 6 is patellofemoral pain syndrome. This section, they discuss the causes and the recommended treatments of each of these conditions. Moving on to section 2, it's called Stretching and Strengthening for Injury Prevention. It contains 2 chapters. Chapter 7 is Stretching for Injury Prevention, and Chapter 8 is Strength Training for Injury Prevention. If you're interested in running injuries, if you have some, you want to know a little bit about them, I think this is a good book. If you want like kind of a general program for your knee, another resource for runners I could recommend is Bulletproof Your Knee by Jim Johnson PT. Book's been out a while, still getting great reviews. Basically, it's good for treat about any kind of knee problem you might have because it treats function. So most pain is the result of something not functioning properly. So if you improve your knee function, pain almost always gets better. It's a 10-minute Bulletproof Your Knee program. Let me just show you real quick a little bit about it. It has like these knee tune-ups. Step 1, keep your quads strong. Just about any problem you can have with your knee, whether you have like a meniscus problem, a torn ACL, arthritis, research is showing that you're going to have problems with your quads more than likely. So it's going to address that with some exercises, keep your quads really strong. And there's actually studies showing that if you have knee arthritis and you just strengthen your quads, your pain gets better. So very key to have that muscle strong. Fine-tune control over your knee. A lot of knee problems are actually caused by problems at the hip. For instance, like iliotibial band syndrome is caused by weak hip abductors. So this will cover you for that. Knee flexibility, if you have any stiffness in your knee or you need it more flexible, give you some exercise for that. Increasing dynamic knee stability. This would be like your proprioception, your position sense. That's an often overlooked part of a rehabilitation program for the knee. But yeah, like I say, 10 minutes, very evidence-based, written by a physical therapist. Doesn't ask you to do anything that there isn't a study to prove that it helps your knee. It's a very concise program. So less than 10 minutes a day, some days even less than that. So if you're looking for a general knee program to prevent a problem, or if you have a problem maybe that's not in the other book, this is one resource to check out. But yeah, if you want to learn about running injuries, I think this is a great resource, so check it out.